as we're speaking, they're reporting that there are now about 57,000 cases, and I presume these would be diagnosable cases that are obviously showing symptoms.
Right.
And so we can assume that the disease there, or the bacteria has spread to a much larger population
Right.
At this point. And the other thing that is, and you correct me if I'm wrong about this, but once the bacteria is present in the environment, it's likely to be there for years and years.
Yes.
Now, because it will be circulating in the population.
Right. It's going to thrive in the water in the environment. Is what's going to happen, and that's the danger down there with the rain and the hurricanes. We have a lot of standing water, standing warm water, where this bacteria could get in and potentially be reproducing all the time, and potentially be then re-picked up through some process from the water, or through some food that had been exposed or eaten out of that water. So you need to always be on the alert. Now, one of the things that's probably going on in Haiti, to let me clarify those statistics, is there are things that with all diseases that make you more likely to get the disease. And in Haiti, number one would be malnutrition. And as with any disease, if the people are malnourished, if they don't have proper nutrition, they're more likely to get any disease, and specifically cholera would fall into that category. So if the second one would be living in close quarters, and the third one would be lack of sanitation, and all those things are going to be prominent there in that area because of the situation that Haiti's in right now. So all of the things that increase the risk are there. Now, there's some other things that increase risk, and some of this goes along with malnutrition, is decreased stomach acid, which is the body's first line of defense against cholera, and probably why people that have good nutrition and eat normally and excrete normal acid from the stomach don't really get symptoms, or don't get it at all. Because the good news is it takes about 1 million bacteria to break that down. That would be about a glass of water to give the person the disease, a glass of water that was tainted with the cholera. So if you were just coming in contact with small amounts of this, you'd have to get to that level in order to even acquire the disease. Of course, having malnutrition and having all these other things will increase the chances of that happening.
So smaller
amount potentially could do it, although usually 1 million is the statistics that I have seen that we go by that's going to kind of kick that off. But if you're taking any, and I don't know how many people this applies to, if you're taking any antacids or any medications that would suppress acid, obviously anything that would suppress stomach acid, including malnutrition, would increase the chances that the cholera would slip through. So having said that, to counteract that, it would be during this time period not be taking those medications if you could avoid it, and to try to keep proper nutrition. There's a couple of other things. Of course, living in close contact with somebody that has been known to have the disease or is potentially infected would be common sense, as that makes it tough. So if you're living in a home with someone that has cholera, you need to be extremely, extremely cautious about being around that person. If you have gloves available, anything you touch, anything you handle, you need to make sure that has been cleaned. Even if possible, the linens, the things that they have been laying on, those would be sterilized in some bleach solution if possible, like a typical bleach washing solution. And even making a bleach solution to follow the directions on the bottle, about 3/4 of a cup to a gallon of water or so, depending on what that particular product. And the reason I say that is bleach solutions will vary from 3.5% to 5.5%, depending on which one you've purchased, and the directions are bound to make that solution to not only clean those clothing in, but to even wipe down objects, even bottled water that you might drink, to have that solution to wipe down the outside of a drink can or the outside of a bottled water can with that. Of course, as with any disease, proper hand washing is going to be important. Keeping your hands cleaned. If you have alcohol solution available, that'll be helpful. To use the proper hand washing, and then the alcohol solution will double the chances that you're killing the bacteria. Now, the other good news is that rarely, extremely rarely, is this disease transmitted person to person. Not to say that it cannot happen, but it hardly ever happens in that fashion. It usually comes by the water that has been contaminated by them getting something, or even eating a food that may have been washed. For example, you need to be really cautious about your food preparation. You need to be cautious about raw vegetables. You need to be cautious about fruit products, especially if the peel has been broken or penetrated in any fashion, like an apple that might have had a slice or a cut in it. Even if it doesn't have a thick peel, cholera can get in there. If it had been washed or cleaned in fluid that was tainted, then that fruit could be potentially contaminated. So the bottom line is you really need to cook everything for several minutes, if possible, at a really high temperature. For water, for example, needs to be cooked for 1 to 2 minutes boiling to sterilize it, and then pour it in a container that's been sterilized. So all of those things need to be cleaned. A couple other things as far as will increase the potential you can get it, which just to throw out, for whatever reason, we aren't sure of all the reasons behind it, people that have O-type blood are more likely to get cholera. That's another little kind of anomaly. It probably has to do with the autoimmune response and how we tag and categorize those different types of blood. So that's something that you need to also keep in mind. One thing I can say about the water, and going back and I apologize because I may not be completely systematic in my thought process, but one of the things is if you do not have access to clean water, then you need to try to produce clean water in some fashion, as I said. So boiling that water for 1 to 2 minutes is usually recommended, and then further treating that water with usually bleach. And usually, depending on the bleach comment, it only takes about 2 to 3 drops of bleach per liter of fluid, so it doesn't take a whole lot in order to further to further clean that water. And you need to really be careful about that measurement, but about 2 to 3 drops per liter will do that. If that is not available, if bleach is not available, you can use, and some studies have shown, due to the acidity and the different contents in citric fruits, you can use a lime or a lemon, a whole lime or lemon, to about 1 liter of fluid will sometimes add to the fact that you're going to continue to give some sterility to that, to kill off the bacteria. And it has to do with the acidity of the citric acid and that sort of thing in the water itself. And that's not first choice, but if you do not have bleach available, that would be a backup. Now, it's primarily critical if someone gets these conditions to begin, as I said earlier, and I go back to this because this is the one thing you can do to help people, is to rehydrate them. And you got to do that as soon as you begin to see these symptoms. If they've got that 20% that's losing that liter of fluid an hour, they can become critical in a hurry, as I said earlier. So getting Pedialyte, which is a rehydration fluid, you may not have that available. Something like Gatorade may be helpful. If you can get just clean water down them, that'll be helpful. But you really need, due to the fact that you're losing copious amounts, large amounts of chloride and sodium and potassium, you really need to get that fluid back in them. If it's not available, an oral rehydration solution does come in packets, an ORS solution that you can add to water using the directions. If that's not available, you can make a homemade rehydration fluid. There are different mechanisms to do this, and different sources. When you look at the CDC or the Mayo Clinic, or even if you look at the World Health Organization, they'll give you different formulas on doing this. One of the primary formulas is one that would contain salt and sugar. About a half a teaspoon of salt and about 6 teaspoons of sugar to 1 liter of clean fluid in a clean container will make a basic rehydration fluid. Now, if you have it available, one of the other formulas you can add to those same 2 things, a half a teaspoon of baking soda, sodium bicarbonate. If you have that available. If you not, most of the sources will say just get the salt the sodium chloride and the sugar into the body, and it will help abate some of these symptoms. And even if the person is throwing this up, they won't throw it all up.
Okay.
A lot of times when a person throws up, when they vomit, we think, well, gosh, all of that came back up. But in fact, there's some residual there. It doesn't all come back up. So even though they won't want to do it, they won't want it, having them sip this water, get this water down, even if it seems like it's coming right back up, is helpful. Now, if someone is in that 20%, of course, as I said earlier, that person, it's probably critical that they get intravenous fluids as soon as possible, because if they're in that 20%, it's not likely that we can orally rehydrate them enough in order for that they survive long enough for these symptoms to abate.
Okay. And once more, would you explain what that 20%? Who are those 20% that are?
Well, those 20% are, if I go back to my statistics, the 1 in 10 that get it, and then of that 1 in 10, there's 20% of the people that get the infection that show symptoms that are extremely severe. Okay. 80% will have symptoms that aren't severe. 20% will have symptoms that are severe, and it goes back to a lot of things. Usually, they will be potentially the very young, in some cases, usually 2 years and up, and potentially they will be the very old. So the very old and the very elderly are susceptible to all diseases, and in this case, cholera is no exception to that. That would be the people that are resistant. Now, in a lot of environments, they don't include the babies, because babies will get some normal resistance from their mothers, from the breast milk. However, since this environment has not, in prior history, been exposed to cholera, it's unlikely that they would have any resistance there in that normal breast milk. So that may not exist. So I would suspect that everyone there, the very young, from birth on, is probably very, very likely that they're in a critical situation. And those people, because the babies, because they're smaller and they don't have the immune system, the elderly, because they have a shift in body fluid as they get older, where you have less part of your body made up. Your body begins to sort of shrink as you get old, I guess is the best way to kind of put it. But those people become critical, because if they lose a few fluids, a few liters of fluid, they can become critical in a hurry. And same way with a small child. If they're losing that much fluid, since they're not very large, they're losing, they'll hit that 10% critical level that I mentioned earlier, which is 10% of their total body fluid, where you become dehydrated. And at that point, you're going to show the wrinkling hands, possibly the sunken eyes, all those really critical things. And that's why they need to be at medical help as soon as possible, where the skin's not bouncing back when you pinch it. There's no rebound, because the body has become dehydrated to the point there's nothing left there for the body to give, and that can become extremely, extremely problematic. So